Our last lecture in cardiopulmonary rehabilitation will cover the outcome areas of functional performance and quality of life measures. Because physiological data as discussed in Lesson 13 does not always directly tie to functional performance, such as seen with left ventricular ejection fraction, ability to perform tasks and gains in aerobic capacity may give us a clearer picture of outcomes. The gold standard for improvements in aerobic capacity is the volume of oxygen consumption. However, since the equipment to perform this test is not always available in all cardiopulmonary rehab centers, other functional tests may be used. They include chair rise tests, seated step test, self-paced walk test, and 2, 3, 6, and 12-minute walk test, modified shuttle test, treadmill endurance test, 10-meter walk velocity test, and the 200-meter walk fast tests. The most commonly used test is the 6-minute walk test, as it is the most recently validated test among patients following heart transplantation and with cardiac pacemakers, obese patients, post-stroke patients, and children with cerebral palsy. It also has a high test to retest reliability among patients with chronic heart and lung disease, heart failure, COPD, fibromyalgia, the elderly, and PAD. To effectively perform the test, the therapist needs a 100-foot hallway marked by 2 cones or a straight path with 50-foot intervals, a clipboard, lap counter, timer, chair, vital signs monitor, Borg scale, oxygen source, and access to emergency assistance if needed. Close monitoring of SpO2 is important to maintain safety. Other guidelines are noted in your reading assignment. Other functional tests include the timed up and go test, or tug test, and the gait speed test. The tug test has 3 parts, including timing the patient from standing up from a chair, walking 3 meters, turning around, and walking back and sitting down. Added features may be counting backwards while performing or carrying a full cup of water while performing. It is predictive of fall risk in the elderly and as a functional outcome tool for heart failure or pulmonary disease patients. Gait speeds or walking speeds are used as predictive tools for a variety of diseases and for outcome measures in the elderly and stroke patients. Gait speeds can also predict the level of ability the patient has in ADLs. For instance, a patient able to walk at 1.5 hours should be able to perform self-care activities. PERME ICU and activity measure for post-acute care may also be used to determine ability to perform ADLs, predict mobility and cognition, and are administered by physical therapists. The last subject we will illustrate in the measurement of outcomes are the health-related quality of life measures, or HRQLs. These measure outcomes from the patient's point of view and give insight as to how the patient's illness impacts their daily life. HRQLs measure perceived symptoms, functional status, mental well-being, social functioning, satisfaction with treatment protocol, and overall life satisfaction. They are also useful tools in secondary prevention, as they can assess outcomes related to smoking cessation, increasing exercise, or decreasing stress levels. Although there are many tests available, we will concentrate on 5 of them. They include the Seattle Angina Questionnaire, the Kansas City Cardiomyopathy Questionnaire, the Chronic Respiratory Disease Questionnaire, the COPD Assessment Tool, and the Cystic Fibrosis Quality of Life Scale. The Seattle Angina Questionnaire assesses the impact of chest pain within the previous 4 weeks. Its purpose is to quantify the emotional and physical impact of angina and is used for patients with CAD or post-MI who experience angina. The Kansas City Cardiomyopathy Questionnaire lists 23 items that address specific quality of life measures in heart failure patients. They include physical limitations, symptoms, knowledge of disease, social interference due to symptoms, and quality of life. It is an important tool for determining patient prognosis. The Chronic Respiratory Disease Questionnaire is a self-administered test that measures dyspnea, fatigue, emotional functioning, and mastery. The patient chooses 5 activities that cause them shortness of breath and answers 20 questions within those domains. This allows for a more individualized test, and it can be used at baseline and at various points throughout the treatment to assess progress. The COPD assessment tool consists of 8 questions that take about 5 minutes to complete. The answers are given a numeric score that determines the overall impact COPD has on the patient's perceived health. The lower the score, the less impact COPD has on the patient. Lastly, the Cystic Fibrosis Quality of Life Scale assesses physical function, body image, and career concerns, weight, respiratory, and digestive symptoms, to name a few. Each question is scored 1 through 6, and the results used to address domains that can be targeted to improve quality of life. This completes our discussion of outcomes to be measured in cardiopulmonary rehabilitation programs and is the last lecture of our course. I truly appreciate your attentiveness and look forward to seeing you in future classes. Thank you for being a great audience.